A leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us we have Dr. Golpa and one of his patients, Frank Vlamings. Frank, welcome to the program.
Meeting you. Hi, Randy.
Yeah, tell me about Frank.
Well, Frank was concerned about his remaining teeth on the upper, and he had a removable appliance on one side. And
so his upper teeth had to go?
His upper teeth had to come out, and he didn't want to go to a denture.
So what about his lower?
His lower, he had a overdenture implant, which he would take in and out.
Okay.
But his main concern was the upper because he didn't want to have a full denture on top.
So Frank, how did you hear about Dr. Golpa?
I actually found him on the internet. I did a lot of research there. I checked with other dentists there, especially surgeons, and I called them up and asked them what their technology was, the technique that they were using. I had these lower implants placed in there. Okay. At that time, there was a clean slate. There were no teeth at all in the lower part of the mouth, and therefore, when they did that, it took 6 months. 6 months from the September 2002 to March 2003 before they finally had it all in there. Then another problem I had, and that's why I did not want to go back to that same technology again, that the bridge what were placed over across the implants, it broke 4 times.
Your lower broke 4 times.
The lower ones. So then I said I have to get new implants on the upper part of my mouth, and I want to find out which doctor actually does it differently than it was done before.
Do they feel like your own teeth?
They feel exactly now, the new ones feel like they're part of me. They're not a part of a story or something. I know what it is like to be without teeth. I know what it is like to be when the standard denture falls out of your mouth. It's so embarrassing. I mean, that is good if you're at home, but if you're in a restaurant, nothing is embarrassing. You have to cover your mouth, you know.
So your upper is fixed, or is the lower fixed?
The upper one
so
is
the upper
fixed.
never
the
comes
upper
out.
One never comes out.
Does it feel like? I mean, they feel like your own teeth.
Absolutely.
Let me see you smile with those. They look great. So it's cosmetic. Do people compliment you on your smile?
Oh, they say you're taking 10 years off, and I asked the doctor if they could take more off, you know, but he said that's very tough.
Just 10 years. That's all I can do, 10 years. And so your lower, the lower is something that snaps in,
the lower we couldn't,
snaps out?
it snaps in, snaps out.
Is it strong?
Because
it's
strong, but
what about a steak? A steak? You can eat a steak?
Oh, a steak, an apple. Try an apple.
We just actually had
we're going to show a video. I haven't seen it.
Right after the surgery, you know. So it's
is it painful? Is it painful?
I tell you, that is what I have to say of this last surgery. It has been an amazing experience to me. I know what I went through for so many months, okay, before. When it breaking, this one breaking off, again there. And I had to go every time through these pain lapses too. That's never mentioned anywhere. So when Dr.
So you had
Golpa,
implants before. It was very painful, took a long time.
Well, the experience afterwards.
Right,
it was to me, it was not done right, okay? I'm not saying that implants are not good. I'm saying that that particular execution of these implants was less than desirable.
So this was easy.
This was a piece of cake. I can't believe it that it was that simple. I mean, you know, when Dr. Golpa explained to me what he was going to do, I said, "Are you sure that I will not have any pain?" He said, "Believe me," and he was right.
Is everybody afraid about pain, by the way?
Everybody's afraid about pain, and you know the cost. You know, this is a much less invasive.
How many implants
procedure.
to give him something fixed in the upper?
We placed 4 implants.
Really?
We took an impression and we gave him the teeth the next day, and this
Yeah.
is and
Is it like having your teeth
him
back?
bite on an apple right away. So
you can't compare it with anything. I mean, if you had partials, if you had dentures, you can throw those away. Get implants, for heaven's sake.
Really?
And the one which are, as Dr. Golpa says, semi-permanent. That way, only the Dr. Golpa can take them out, and if there's any work to be done on it. I don't have to take them out every time.
So you brush them just like regular teeth?
Absolutely. Use a water pick, and you'll be surprised how clean they are.
Go ahead.
I want to tell you one other thing, too. My other friends, they got beautiful teeth, but they can't eat a piece of chocolate. So, oh, no, I got to get cavities. I don't have to worry about cavities anymore.
Because of dental implant. Now, is there anything that surprised you? Anything you were able to do, or a change in your personality, or did you smile more?
There's too much to mention here.
Really?
Your own personality, your own feelings, your own confidence and everything else is gone sky high all at once. I mean, I feel...
But just because of your teeth?
Yes, right. Before I had the rack in there, you know, it was a disaster, actually, and they could fall out anytime. I don't know if you ever had, if I was afraid on these pictures, and the pictures will show it here, the picture cannot show how loose the teeth were, okay? And I don't know if you ever had loose teeth, anyone, but if you have that, you're afraid to bite on something because you know you're going to leave it behind.
No, okay, so we did a clip, okay, or, I mean, you did a clip that you brought to us.
Right after the surgery.
So they place these dental implants, so I get this correctly. They place the dental implants.
Place the dental implants.
And then he bit into an apple.
He bit an apple right away because I want him to have confidence with these teeth so he can bite on.
Were you
anything
afraid to do that?
Well, I tell you, it was strange that I had to open my mouth so big for a whole big piece of apple. He gave me a huge apple, you know.
But isn't the implant too loose at that?
No way.
No, because with these implants, the beauty of it is, you know, we can gain enough stability to place the bridge right away.
If a doctor tells me that it takes 6 months for the bone to grab onto that implant before you could bite into an apple, I knew we were going to talk about this today, so I asked around.
Right.
Are you just saying that's old?
That is old. That is the old conventional
But they used
implants.
to think this, you're saying.
Well, there is still conventional implants that we have to place for single tooth, and we have to wait for bone integration to take place. But
bone integration?
Yes.
Okay.
But then with these implants, we can put them in at a very high torque, so we can go ahead and place the bridge right away.
And there's really no pain.
You don't feel it.
It's computer-guided surgery, so it's less invasive. The implant goes right into the bone. There is hardly any preparation. The implant actually cuts into the bone and grabs onto the bone. So that's what's the difference between this implant and the conventional implant.
Now, we have one of your female patients that flew in for this interview as well.
Right.
Is it more men? I mean, more women than men, or more and more men are coming in?
50-50.
Really?
Whoever who needs, you know, who needs.
Do you
to
tell
get
your friends about this,
teeth.
Frank?
A lot. They see
What
it
do they
every
say?
day. They said, "You look good." I said, "Just look good. I feel good too." That's the important part to me.
Are you eating
know.
foods that you stayed away from
Any
before?
feed. I can eat steaks even.
I
Even
mean-
tough steaks, you know. Before I couldn't do that. I was afraid to leave things behind. You know, and that I was biting on my own teeth, basically. You know, not anymore now. I can eat I eat hard candy, which I won't do right there because I'm always afraid to chip things, you know.
Okay.
But before, I could never eat an apple. I had to cut it like an old man, you know, in little pieces and all of that. No more. No.
Does it make you feel younger?
Oh, so much. I don't know how many years younger, but
You do.
it just feels good. Yes,
Is
I
it
do.
better than you expected?
Oh, there's no comparison to be made because I went through 6 months waiting time before I finally had the lower ones in it, and then to go through all these repeats and repeats.
But
and
not with
repairs.
Dr. Golpa.
No way. This is 2 months ago.
Well, then
this
what were
was
you
done.
doing different than the other dentist? Without being negative.
Basically, there's a lot of dentists out there that they claim that they do this procedure, and they even advertise for this procedure.
But they dabble in it?
But
or?
then when the patient comes in, they tell them, you know what, you are not the right candidate. We still have to go through the conventional way of placing implants, waiting 6 months, doing bone grafts, sinus lift, and everything.
So you're the surgeon, and you do the surgery.
I do the surgery, and I do the from
and you
A
put
to
the-
Z. Yeah,
normally
we do-
that's done by two different people.
Exactly.
Is that right?
It's done by the oral surgeon or a periodontist, and the prosthetic part is done by
And Frank, when did you know, when you met Dr. Golpa, when did you know this is the doctor? Did you have a-
Immediately, because I asked some key questions. I asked the questions, will I truly not feel that pain as I have in the past? And Dr. Golpa immediately verified that, said no way, because he knew what I went through, you know, as a professional. And I had to go through it as a client, as a customer.
Well, my mother is one of those people. I sent her to you. They
Right.
said, not enough bone.
Right,
You said.
exactly.
So is there
So
always enough bone, by the way?
Well, we use whatever bone is existing. I'm not saying that everybody is a candidate,
Okay.
but the best candidates are the ones who are losing their teeth, who are about to lose their teeth, or who had denture for maybe 5 to 10 years. So
Okay.
the longer they had the denture, the lesser they become the candidate. So
Frank, there are other people that will, and we're going to have to take a quick break. There are other people that are going to watch this program. They have dentures, but they're afraid of the pain, the process. What do you say to them, the people that are afraid?